you touched there on cardiac rehab and exercise programs. Have you got any advice for people about how to get themselves referred?
Yes,
The ins
so
and outs.
I didn't discuss it there, but there's two ways or a few ways you could go about it. Sometimes with patients, you might have a cardiomyopathy specialist nurse. If you have frequent touch points with them, you can have a discussion with them about it. Otherwise, you can. It's in relation to the cardiac rehab service you would be referred to will be the one in relation to the proximity to your GP. So basically, what that means is when I've done cardiomyopathy support groups before, I'd be speaking to patients in kind of like in Kent, and they would go back to London for their specialist care, but they wouldn't be able to get referred to a cardiac rehab in London. They'd have to get referred to a cardiac rehab in Kent where their GP is. So you would speak with your local hospital, call them up, or you could speak with your GP. Um, whether would it be beneficial for you or not will vary from person to person. It all depends on that kind of individualized talk that you might have. You might be a 30 something year old and you're in a room with 70 something year olds. You're like, I'm too young to be here. I feel a bit out of place, which can be a bit of a challenge. So it's all about that kind of initial consultation that you have with that team, that how they frame it, how they individualize the care to feel that you're going to gain from it. If you've had the diagnosis recently, you would gain more from it. If you've had the diagnosis maybe 5 years ago, 10 years ago, you might feel it's knowledge that you already know and that you don't really want to be repeating. So then there's also other groups about phase four, which is cardiac groups that are in your local community that exercise patients more on a long-term basis. And then you can go on to a cardiac rehab finder and it shows where those um, where those groups are. So just to recap, you can talk to your local hospital, talk to your GP. I'm sure cardiomyopathy nurses could help with that as well about facilitating that. Um, and also as well, I can send out links if there's a need be as well to yourselves that you can to send out to patients to find
Brilliant.
what's local to them. Obviously, if
That's
you're in London, there's a bit more compared to if you're in, say, in Scotland. It's
yeah.
really far apart, and same with Wales, etc.
Postcode lottery.